broadcast on LinkedIn this morning. And hey, I really appreciate you joining us. I sent out a little message yesterday, and the message that I sent out yesterday was that we're going to have another discussion with healthcare, or the healthcare professional. And so I appreciate you jumping online with us today. And today's topic, which I sent out yesterday, was killing of the coronavirus. And we learned some really important information yesterday that we felt like was really valuable and very important to us. And so we wanted to get on live as soon as possible to be able to share it with people around you, around us. And so this broadcast is going live on LinkedIn and YouTube and on Facebook. And I wanted to ask for you, if you would, to share this broadcast, because we believe it's extremely important information that we didn't know. We were very shocked and very surprised about it, about how to kill the coronavirus. All right. And for those of you that are just joining live right now, we're going to do a few introductions, and then we're going to go right into this information. First of all, I wanted to say, for those of you that follow me and know me, Mark Schultz, thanks for being online. We have a really important subject to talk about today. And I also have with me my wife, Susan Schultz. And I wanted to point that out very specifically because in this time of social distancing, I wanted for those of you who are watching to know that, we live in the same household. And so we are actually in our home right now, and we're broadcasting from our home. And so our social distancing is close quarters.
It is.
Yeah, right. Yeah.
Today's our anniversary.
Oh yeah, today's our anniversary.
Oh, happy anniversary.
Exactly. Thank you. Yeah. And then we also have online with us Betsy Mead, and she's coming to us from her office in Florida. Betsy, hi. Glad to have you here with us today.
And thank you for having me.
Yeah, great. And just really quickly, is Betsy is the Chief Nursing Officer and Chief Operations Officer for healthcare managers in Florida and in the surrounding area. And healthcare managers manages assisted living facilities and skilled nursing facilities, like I said, in the Florida and surrounding area. And Betsy's role is the Chief Nursing Officer and Chief Operations Officer. Now, Betsy, Chief Nursing Officer, how does that qualify somebody to have a discussion about healthcare? What is your background? What do you actually do?
Well, I've had numerous positions in healthcare, but for 15 years, I worked for St. Joseph, which is part of the Baycare system in Tampa, Florida. And I worked in various roles, but near the end, I was the Director of Patient Services, which is basically the Director of Nursing over multiple units in the hospital. But through all the years, I've accumulated my master's in nursing my master's in nursing and master's in healthcare administration. And I have played various roles in the hospital, like I said, and now I'm here with healthcare managers as their chief nursing officer.
Okay, excellent, very good. And Betsy, and the reason that we're affiliated is we do some work together in sales and marketing as part of my business. But Betsy is also our sister-in-law, and so she's family. And so because we had direct, immediate access to this valuable information, we wanted to be able to share it with people about the coronavirus. Now, we want to cover three primary things today, and we're going to start out by just to quickly give you some information about the coronavirus because it pertains to killing of the coronavirus. And so, Betsy, yesterday you shared some really interesting information with us about sort of the coronavirus and what it really is and how we go about killing it through disinfectants. Now, can you tell us sort of what it is? Can you kind of start out with that and help people understand that?
Sure, not getting into too much of the gritty details, but basically there's three types of viruses out there. You have the envelope virus, which is the easiest virus to kill with disinfectants and cleaning. Then next is you have your large non-enveloped, and then you have your small non-enveloped. The small non-enveloped are your hardest viruses to kill. Well, the coronavirus, so the COVID-19, is the enveloped virus, which is the easiest to kill. Now, believe it or not, that's great news for us because it's also it's sensitive to heat. So heat does affect it too. And compared to the small non-enveloped virus, which is resistant to heat. So that makes it easy to kill for healthcare industries that are using the appropriate disinfectants and the appropriate contact times. And I know we're going to discuss those contact times in a bit.
Okay, very good. Yeah, that's exactly what we're going to go into. We're going to talk about, how you disinfect or how you kill the coronavirus. Now, Betsy and I were talking on the phone yesterday, and we had some information which was, she shared with us that were really misconceptions on our part. I mean, listen, I mean, I'm 60 years old and I've gone my entire life not knowing this information. So the stuff Betsy shared with me yesterday, was really valuable and very important about how to disinfect and how to kill the coronavirus, in our normal home kind of environment. Now we're going to get into that in a second, but I wanted to mention to you that we are live on LinkedIn and YouTube and on Facebook, and we do have the ability to take questions. And so if you have questions, I wanted to encourage you to jump on this live session and ask your questions, because we do have the ability to be able to interact with you live. Now, what we're going to do right now is we are going to pull up a website. Turn the volume down. We're going to pull up a website, which Betsy, why don't you tell us what it is you shared with us yesterday about the website, and while you're doing that, I'm going to actually pull it up.
Okay, so as healthcare employees, we refer to the Environment Protection Agency, or the EPA, and we actually have to, and it's our due diligence to do this, we look on that site and it will tell us if the products we're using will kill COVID-19. But this website is available to the public. You can check products you have sitting on your counter right now through this website. It's a great resource. It's a great tool for you to have just in case, if you're trying to figure out if what you have at home is killing COVID-19, or you want to find a product that does. Mark's got the website pulled up there.
Yeah, I got it pulled up behind me here, and
EPA.gov.
Yeah, well, actually, yeah, it is on the EPA.gov, and it's kind of a long URL. And so what I did was I actually put it in the post, which goes out. And so, but we can, I'm going to put it up at the end as well, but it's EPA.gov/pesticides-registration/list-n-use-agents-SARS-CoV-2. It's too much to remember. So yeah, I put it into the live broadcast so that you would know where it is to go to. But this is very, very interesting. Now, Betsy, we talked yesterday, you told us a little bit about what an EPA registration number is, and I didn't even know what it was, but over here on the left, there's a column here.
Had them.
Yeah, there's a column here called EPA registration number. Now, what is that?
Okay, so any disinfectant that a healthcare industry would use, or even some of your disinfectants at home, will have an EPA registration number. You can grab your bottle of Lysol, Clorox wipes, whatever you have at home right now. You have to kind of look for it, but it's usually right next to the barcode of the product, and it will give you your EPA registration number.
So we have we collected 5 or 6 products from around our home here, and here's a disinfectant, spray cleaner. And Betsy pointed out to me, I'll put this up close. She pointed out to me that there's a barcode there, of course, and I know you can't read it, online, but there's a barcode, and then to the left of it, there's a bunch of really small text next to the copyright information and things like that. And I'm going to take a look at it here on this one I have in my hand. And this one says the EPA registration number is 777-91. Okay, is what it says there, right? So I see over here on this website we have a bunch of numbers and things under the EPA registration that this is a product.
This is a Lysol Kitchen Pro antibacterial cleaner that I've been using in the kitchen every day.
Well, why don't we, Betsy, why don't we type that one in? Susan, show them where the search box is up there, and then I'll on the top right up there, so, and I'll type this in. What was the number you had?
It's
777-91.
-91. Okay. So all right. Okay. So Betsy, you may not be able to see that there, but it says 777-91, and it said quaternary ammonium, and it says Lysol Kitchen Pro antibacterial cleaner. Is that what we have there?
That's what it is.
All right. So what am I looking at here now, Betsy?
Okay, so basically you're having the active ingredient. You have your, obviously your EPA registration number, your active ingredient, and then what the product name is, the company that makes it, the following disinfectant directions and preparation following virus, human coronavirus, you see there.
So I know that on some of the others I looked up, they said other viruses, okay, but this one happens to say the human coronavirus. Now, I looked this up, Betsy, but it did say when I looked it up that the other viruses were harder to kill than the coronavirus. Right. And so this list here is actually addressing disinfectants and things which have the ability to kill the coronavirus. So I wanted to just point this out, is if you search on something on this website and it says that it kills a different virus, all right, the website gave us instructions that said that those are harder to kill than the coronavirus.
Right.
So the whole purpose for this list is to give information about how to kill disinfectants to kill the coronavirus, okay?
Right, and this list is actually referred to as list N because
Okay.
it kills COVID-19.
Oh, all right,
Okay.
okay, all right, that's what that means, because it says list N. All right, okay, perfect, thank you, all right. Okay, and then it says up here, contact time in minutes. Can you talk to us about what that is?
So contact times, in healthcare, we know contact times of all of our disinfectants. And what that means is, that means how long the surface has to remain wet to kill that virus. That means that surface needs to be visibly wet for 2 minutes with this product in order to kill the coronavirus.
Yeah, now I'm telling you, this is the part that was eye-opening to Susan and I. We had a discussion about this after you told us this yesterday. We did not know this, all right? Our normal practice, I mean, Susan, you know, what's a normal practice around the house for wiping down a surface?
Well, usually, you spray it on and then you wipe it off.
Yeah.
I mean, once in a blue moon, I'll let it sit there, but usually not 2 minutes.
We did not have any idea what contact time was. And, Betsy told me in our discussion that, well, contact time is normal. We all know that in the healthcare industry, and we're like, I have no idea what that even means.
I mean, we're not patient, to wait 2 minutes before you wipe it off. And how many of us are really reading the directions on how to disinfect and how long to put it on?
Right.
Or leave it wet.
Betsy, if I were using a product like this, and if I were using this to disinfect, we looked it up here and it says 2 minutes contact time. What do I do? What does that mean?
That means you have to spray your surface, make sure it remains wet for 2 minutes. If you have to add more product, then that's what you'll have to do to keep that surface wet for 2 minutes.
Okay. Now, again, why is that important? What's the relevance of that? Okay.
Because according to the EPA, that is the amount of time it takes to actually kill the virus.
For this product with this active ingredient to kill the virus. Okay. Yeah. Right. And I can't tell you how many times we take that, shoot it on the counter, grab a rag, wipe it down and call it done. All right.
Right.
And also, go ahead.
The important thing to remember, I mean, that's a spray product. That's probably a little bit easier to keep wet for 2 minutes. But when you use your Clorox wipes and your other disinfectant wipes, how many times have you wiped the counter and it dries pretty quickly. So sometimes you have to use a little bit more wipes and keep that surface wet.
Okay. So I wanted to keep this moving here.
I just want to ask a question. A lot of times our cloths are wet. So is that diluting it even more? And should we put it on a dry cloth instead of a wet? Is that going to?
Oh, that's an interesting question. I would think just as long as you keep that surface wet with the product. Okay. So you might not want to add it, you want to make sure you keep it get a good coat on your countertop and keep it wet.
We have a sloppy white rag that we're using with.
That sounds like a bad idea.
I know.
Yeah, right.
Yeah.
Okay. Well, we did go around the house and gather some other products, and we found this bleach product as well. And so, Susan and I, we've always been, like, oh, bleach, it, kills stuff, disinfects. And, like so we thought this is like, this is like the killer stuff here. We said, we're
strong stuff.
Right. We're going to look this one up. And so what we did was we went to the label here. I'm looking at the label again. All right. And I found the label here, and Betsy, if you want to look it up on your end, it was can't read so good, 583-100. 583. Is that right? No, 5813. 5813-100. Yeah. Does that one exist?
Yep.
Okay, because
if I had the number right, did you put 583-100?
581. Oh. Is it 13? 5813.
5813. Now I put in 5813, and there's a lot of 5813 products,
100.
right? And then we put in 100, and it comes up as here it is right here. Comes up as sodium hypochlorite. Okay.
This is what I was shocked about.
Yeah.
You look at the contact time is 10 minutes.
Yes.
For Clorox, I just thought Clorox would kill things like immediately.
Instantly.
Bleach. I mean, our impression was bleach. Oh, that kills everything. We can just sloth the house with bleach and everything will be okay.
That's what I've been doing. I was feeling very confident about
right. Yeah, exactly. Only we were super, super surprised to find out that this particular product that we're using actually has a contact time of 10 minutes. Okay.
10 minutes.
That, I
To
mean,
leave on wet
so
until it dries.
Well,
Right.
one thing, Mark and Susan, that you have to remember is that that contact time is, and you use it how you were, I would use it for what it is, but that contact time is to kill that virus, the hardest virus
yeah.
to kill. So you have to
Okay.
kind of keep that in mind.
Okay, so is this
The
canine?
canine
Oh, okay.
parvovirus.
Okay.
All right.
Okay.
You know, so you got to kind of keep that thought in mind, but yet would I use 10 minutes in contact time right now? Yes, I would.
Yeah. Okay. All right. Well, listen, the message that we were getting out of that, that Susan and I were getting out of that, is that we are not putting product, you know, for
Leaving it
disinfecting on long enough. There's no question. I mean, we need to extend the amount of time that we're putting on surfaces to disinfect it. I mean, that's the biggest message that we got from you, that we can't thank you enough for, because we had no idea that
Right.
and in a time right now where we're trying to figure out how to disinfect and to kill viruses all around us, and you know, I mean, it's important to have good information, and clearly this was a misinformation on our part on really what these products were capable of doing and what the proper instructions were, you know, for doing this. No question. Well, let's take a look at maybe one other that I thought was important to do. Is one, we have some generic products around the house, and we thought,
This is the, you know,
yeah,
the elusive isopropyl alcohol.
yeah. Right.
You
Now
can't find
you can't find it anywhere right now.
Yeah.
We happen to have this in the house
it
already.
before everything
Yeah.
came
So
down.
Susan, what do we have here? This is like a generic product,
Yeah, just
right?
a generic, you know,
Okay.
alcohol,
Right.
rubbing alcohol,
Yeah.
70% strength.
Now I flipped that over and looked at it, and I started looking for the EPA registration number, and I couldn't find one. All right. So Betsy, I guess everything doesn't have to have an EPA registration number on it to sell it, or
Right.
okay. So
what I would look for is active ingredients.
active ingredient. And so Susan, what were you finding? Well, obviously the active ingredient is isopropyl alcohol.
Right.
Yep. Yep. And what I had done yesterday was I did a quick search on the website and just did a search on, hold that, I'll just put in isopropyl real quick.
In the search bar.
Yep. Go to the search bar, and then you look here and you just type that in, and a number of products start coming up, you know, with isopropyl, you know, alcohol. And here down at the very bottom, here's one that says, you know, here's a product that says isopropyl 5-minute, you know, contact time. And so I guess the best thing, you know, these are 5-minute, 3-minute, you know, contact times. And so the best thing that we could do, maybe tell me if this is valid or not, if we don't have an EPA, is to get some idea of how long it should be down.
I'm sorry, Mark, can you repeat that?
Yeah, no problem. So if I did a search on,
You can find it.
if I didn't have the EPA registration number, if I did a search on the active ingredient, would it be valid at least to get a general idea of how long that should be, you know, in contact time, just to search on that active ingredient?
Yeah, I think it would give you a good idea. There's, you know, there's a lot of generic products out there that have comparable active ingredients.
Yeah. Okay.
But, you know, try to stick to the list as much as you can. I mean, I know in healthcare industry, we stick to the list, but at home, it would be good. Okay to do.
It's a little difficult. It's a little difficult at home. Yeah.
And I
Okay.
know there's more, you know, there's more concentrated alcohols, more than 70%. There's 90, 91%, 99%.
So,
Yeah.
so Betsy was telling me something about the percentages, you know, that are required. So Betsy, what do we know about the percentage of alcohol required in order to disinfect?
Right now, they're saying 60% alcohol. So any hand sanitizer that you have at home should be at least 60% alcohol in order to kill the coronavirus.
Okay. All right.
And, you know, when you're putting that hand sanitizer on, it's important that your hands remain wet for a good amount of time. You rub it between your fingers, under your fingernails. The best thing I've seen is that coronavirus is like glitter. And if anybody has dealt with glitter, you know that once you have it, it kind of, everything you touch, it goes. So you have to think of coronavirus like that. So you want to make sure that you're getting every little, your thumbs, under your nails and everything when you're rubbing your hand sanitizer around.
Okay.
Glitter's hard to come off. Yeah.
It is, and it goes everywhere. So
Yeah.
that's kind of how you want to think of it.
That's
Okay.
a good visual.
Yeah, it's a really good visual. All right.
Right.
Okay, great. All right.
Okay.
Well, okay. So as far as the products are concerned, then is that I would, you know, I would really encourage Betsy, you know, you have really, you know, opened our eyes on this, is that number one, we didn't know that this EPA website existed. All right. Number two, we were not familiar with the contact time And number three, we didn't know about the EPA registration numbers, all right? And so, we immediately gathered up, a bunch of our cleaning products in the house and started looking at them in order that we could better familiarize ourselves with these products and what it was going to take to be able to, kill the coronavirus, all right? And so we just can't tell you how, valuable that was to us. And so that's why Susan and I wanted to do this this live. Susan, Susan, her business is healthcare and health and wellness and nutrition. And, around the house, she's always communicating and being concerned about, our nutrition and our immune system and our health and our wellness and disinfecting. That's just like always on the forefront of her mind. And so when I shared this information with you, I mean, it was really pretty surprising.
Yeah, it was. It was shocking, actually.
Yeah. Yeah. I mean, Susan always questions things, and she immediately had to, go do some research and find out if this was really true or not, because she wants it to be right. She wants the information to be right. Yeah. Right. So this is really valuable information for your business and for all of us just in a home trying to disinfect. Yeah. Right.
Like people that are trying to kill germs.
Yeah. So Betsy, the third thing that we wanted to talk with you about today, we've talked about, the virus and some of the ways that it can be killed or disinfected, and we can disinfect surfaces. Now, being a healthcare professional, I know that you're concerned about that in your facilities, all right, in your assisted living facilities and your skilled nursing facilities. Are there tips that you can share with us about what you do in the facilities that, we can apply that at home so we can better understand techniques, just like what you shared, this technique? Are there ways that we can apply that to home? How do you disinfect in your facilities?
In our facilities, we use, obviously we're constantly disinfecting, especially now, but, think of things like commonly touched areas, telephones, handrails, doorknobs, but keep your own pin. I always say, don't share your pin with other people because you're not carrying around that disinfectant, with you when you're out and about. But making sure our common areas, in your phones, definitely. Our common areas, we are cleaning over and over and over again. Even though right now we have stopped our communal dining and we've stopped our activities, which breaks my heart a little bit. We have to do that for our residents, but it's the thing we need to do to keep them safe. We still are cleaning those areas in the hallways. In our facilities, we're very fortunate that we have the Clorox 360 machine. And basically what that does is it's a big like sprayer machine that sprays a Clorox disinfectant, which does kill coronavirus. I checked it on the EPA list, but it creates an electrostatic charge. So it actually like wraps itself around handrails and different wheelchairs, beds, things that tend to get like all the little nooks and crannies of equipment that tend to get missed with normal cleaning. So we've been running that machine down hallways, in rooms, in offices, everywhere we can to help just try to eliminate or prevent the virus from being in our buildings or spreading.
Okay, so you have equipment that's actually better designed for things like that. Yeah, because I think about, like wheelchairs and things like that, all the nooks and crannies. Wow, you have equipment which actually can envelop that and better disinfect those things. So that's amazing.
That's with Clorox?
It's a Clorox disinfectant that we put in the machine.
Okay. So, you started listing, that's really good, all the kind of different places that we should be looking at, doorknobs and, handrails and things like that. But aside from your super duper, Clorox 360 machine, what should we be using then to clean the doorknobs and, the handrails and things like that? What should we do?
I would suggest just using your Clorox wipes or your Lysol wipes that you get. Just make sure you pay attention to your contact times and that you really make sure that they stay wet for that amount of time.
Okay.
And if we can't get wipes, then maybe a paper towel or some sort of clean cloth.
I'm just looking real quick at
different cleansers that are out there, like the cleanser you had for your kitchen.
Right, with the cloth.
Yes. Yeah. So we've had a few people that have joined the live session a little bit late, and at the beginning we talked about the EPA website, and I had somebody ask a question here about EPA products website. What is that? All right, and so I'm just going to quickly again say that we have up on the screen here the EPA, the Environmental Protection Agency.gov website, and we have a link that we have put in the slide. When I'm done, I'm going to post a link so that you have access to the link. But it's kind of long and it's hard to find it. But the way I found it originally, Betsy, you told me just do a search. I think you told me to do a search on EPA list N and coronavirus or disinfectants.
Or EPA COVID-19, and it usually pops up the top of the search list.
Yeah. So I have a question here from Malik, and Malik says, what's the EPA products website? And what I'm going to do here just briefly is, so it's on the screen, is I do have it on a PowerPoint. I did copy it to a PowerPoint. And Susan, if you could just step aside just for 1 second out of this. Yeah, there you go. And right here, this is the EPA Environmental Protection Agency website. And this is the list N. And Betsy, what did you say that stood for again? That's
just kind of the list. They call it list N for COVID-19.
COVID-19. Okay, list N, disinfectants for use against SARS-CoV-2. And then here's the link. Here's the link to the website. And that's where we got all the good information about the EPA registrations and where you can look up the products for what their contact times are. All right. So anyway, that's really good. All right. So Betsy, are there any other tips that you can give us, that you use cleaning around the facilities that would help people, at home to really make their homes, safer and really to kill that coronavirus? I mean, to disinfect. I mean, are there any other tips you have?
Not really. Just make sure, including in all of that, your hand washing. Hand washing is really, really important, and making sure that you're doing that with every interaction. You can make sure you do your 20 seconds, 15 seconds, count your ABCs, make sure you're getting your hands washed well.
Okay.
And then use your products around your home to look at those doorknobs or areas. If people have been self-isolating the way they should, limited people should be touching those areas. But, a good wipe down every day, it doesn't help it. That won't hurt anything,
Good, great. Well, listen, I got to just tell you again, is the whole reason that, I really appreciate you coming on today, Betsy, and doing this broadcast with us, because I just can't tell you how surprised Susan and I were when we had this discussion. I mean, you said, have an interesting topic to talk about, and you brought it up. And it wasn't just interesting to me, it was actually, kind of shocking, because our common practice is not to have a contact time as the average individual around the house. I mean, maybe I'm unusual, but I talked to one person yesterday, Betsy, who was also not a healthcare professional. And I mentioned to them what you and I talked about. And this guy I work with on the phone, he said, "Are you kidding me? I had no idea." So between Susan and I and this person I talked to, I mean, we're all just really appreciative of you taking the time to share this kind of information, because I feel like it needs to get out. And if you're watching this, I really would appreciate it if you would share this broadcast, and if you would share the recording after we're not live out onto your LinkedIn, because this is really important information. If we want to stop the spread of the coronavirus, social distancing we've been told that that's really an important aspect, and just killing the germs and things around us is really important. And this is just something that I feel like the average person doesn't know. And so Betsy, we really appreciate you providing that information. This is really something I think will really help people.
Yeah.
Well, great. No, thanks for having me, and it's great actually seeing you guys.
Yes.
Yeah, right. Yeah, it's good. All right. Okay. Well, hey, listen, thanks for joining us today. I really appreciate you watching. Like and share this broadcast. Get the word out about how to kill the coronavirus. Here's the EPA website. Susan, step aside one more time. Here's the EPA website. I'm going to post it into the broadcast, but go here, check your products, make sure you understand the contact times for those products, and let's kill this thing. Let's get healthy and be able to get our industries back to work, so that we're not having to be at home all the time. Hey, everybody, Amen. Thanks for being with us today. Fair winds and following seas to you. Bye.
Bye.